And let's start. So we are going to go through 10 stations. Okay, so this is our station 1. So start the picture below. So you can see this picture and this device here. Then name the equipment shown to max, and what drug is used together with this device to max. Then name 2 common childhood diseases in which this device is used to max. Then list 4 classes of drugs used to treat the commonest of the 2 conditions. Okay, so name the equipment shown. As you can see, there's a face mask here, then of course this is a nebulizer. Okay, so nebulizer with a face mask. Then what drugs is used? Then this is one of the drugs is used, salbutamol, but of course there are also other drugs which are used, but we just since the question was asking what drug, then we just picked salbutamol, but of course don't be limited. Yeah. Okay, the name 2 common childhood diseases in which this device is used. So we have asthma, bronchiolitis, and croup. Then of course there are others. Then list 4 classes of drugs used to treat the commonest of the 2. So here, let's say our two childhood diseases, we have asthma and bronchiolitis. These are our 2. Then the commonest among these 2, we have asthma. So the classes of drugs, we have beta 2 agonists, corticosteroids, leukotriene modifiers, and also methylxanthines. So those are the classes of drugs used. Okay. Then station 2, the diagram below shows a skull X-ray of a 5-year-old. Then this is a skull X-ray. Describe the X-ray to max what is the most likely condition. If it is your first time seeing this patient, what 4 investigations will you do? List 4 clinical crises associated with this condition. So as you can see, there is this as if there are spikes coming out of the skull. So these are called, on description of the X-ray, we are going to say air on end appearance on the skull. That's the description on the X-ray. Then what is the most likely diagnosis? Sickle cell disease. Then if it's your first time seeing this child, of course you are going to do your HB electrophoresis, your secret test, HB solubility test, peripheral blood smear, your full blood count, differential count. So you, of course, when you're writing your exam, you don't have to put the initials, you have to write in full. Then of course you can also do others which I have not mentioned, such as high performance lipid chromatograph, if I'm not mistaken, HPLC. There are also others, but these are the ones I could manage to indicate here. So don't forget the initials. You are supposed to write in full. Don't write initials as well. Okay. Then crisis, we have vaso-occlusive crisis, aplastic crisis, splenic crisis. Then we also have hemolytic crisis. So on splenic crisis, know that okay, it's not only the spleen which is involved. So that's why it's called sequestration crisis. Then of course in the sequestration crisis, it can be the spleen which is in sequestration crisis. That's why, but it's the most common. So maybe if the doctors who are marking you, they want you to put sequestration crisis, so best put sequestration crisis. Okay, so we move on to station 3. Below is the chest X-ray of a 12-year-old girl who presented with a cough, then chest pain on the right side, and difficulties in breathing for 1 month. So she has been experiencing difficulty in breathing for 1 month, chest pain, and also a cough. Describe the chest X-ray. List 4 differential diagnoses. What is the most likely diagnosis? What are the 2 complications of the above diagnosis? Then what clinical procedure will you do to relieve the chest pain? So here, as you can see, there is this white thing here. So and even the trachea has gone somewhere. So how are we going to describe this? are going to describe this. So this is a homogeneous opacity on the right side of the chest. So which is this is the right side of the chest. Looking at how the chest was taken, the chest X-ray was taken. This is the right side, and there is a homogeneous opacity here. Then we also have tracheal division to the left. So this is the trachea. As you can see, it's not centrally located. It's deviated to the left side. This is the left side. Okay, then list for differential diagnosis. So it could be, so this is most likely right-sided pleural effusion, just that most likely a pleural effusion is always secondary to something, just that uh, here we couldn't actually get which one will most likely cause the pleural effusion here. Then it could be pneumonia, it could be pulmonary tuberculosis, congestive heart failure. So just put the differentials for pleural effusion. So what can cause a pleural effusion this big? So just put your differentials for pleural effusion. Then what is the most likely diagnosis? So here we are going to say right side the pleural effusion alone. So uh, one of the markers actually marked this. I think one of the markers I asked, they were marking this one to be correct. 2 marks. It will indicate right-sided pleural effusion because that's what the patient has presented with, and you have been given the X-ray, so of course you can go with it. But otherwise, if you are clicking in your outpatient department and you see there's pleural effusion, make sure you try to find out what is causing the pleural effusion. Yeah, so make sure there's a secondary something like what's actually causing the pleural effusion. Then okay, that's for practical. Then okay, but here I think it's fine like this. Then what are the two complications of the above diagnosis? So we can have pulmonary failure, lung abscess, respiratory distress syndrome, empyema, and of course others. Then what clinical procedure we would do? So we can do a thoracocentesis, or we can just say pleural tap. Okay. And station 4, the picture shows a child with generalized edema. One, list for differentials. Uh, the patient's urinalysis shows protein stress. So this is the results for proteins were stress. Then the blood the blood was negative. Then what is the most likely diagnosis? List two signs of this condition. What are the risk factors associated with this condition? List four fatal complications of this condition. So as you can see, this child, there's edema here, and like they've said, generalized edema. So differentials, we have severe acute malnutrition, nephrotic syndrome, congestive heart failure, protein losing enteropathy. Then question 2, the patient analysis, protein stress, so it's not nephrotic, it's not protein losing enteropathy. Then blood negative, we then what's the most likely diagnosis? So most likely diagnosis in a child like this is SAM, which is your severe acute malnutrition. And then signs of this condition, we have dermatosis and severe wasting, edema. So for EA on the most likely diagnosis, others even put in bracket to say kwashok, because they look at the edema. But the reason why I removed it, because sometimes kwashiorkor can also occur with marasmus, so the marasmic kwashiorkor. So we are not sure which is which because we haven't been given a lot of data. But severe acute malnutrition, you can get 4 marks here, and here you can include signs for both. You can just indicate as long as you have 2. Then risk factors associated with this condition, again this here it makes sense because we are going to give risk factors for some, which are low socioeconomic status, your drought, large families, or famine, immunocompromised or immunosuppressed, recurrent infections, lack of education, lack of female empowerment. Then list for fatal complications. So on your management of some, the first 5, those are your fatal complications. So we have hypoglycemia, hypothermia, dehydration, infections, electrolyte imbalance. Then station 5, a 10-year-old boy presents in the emergency room with history of fever, headache, and vomiting for 3 days. Then below shows the urine he passed when he was admitted. So history of fever, headache, and vomiting for 3 days. Then the urine is shown here. What is the most likely diagnosis? List 4 investigations you will do. What complications of the disease has it developed? And then how will you manage this patient? Then 2 days later, the boy stopped passing urine. What complication has it developed? And then also, if you follow through the signs and symptoms given here, this is most likely severe malaria. And also from this point, we are going to know on question 3. Okay, so this is most likely severe malaria, and the investigations we can do. So we can do malaria parasites, urea and electrolytes, creatinine, kidney function tests, your full blood count / differential count, your random blood sugar, your serum glucose. Then you can also do others, but these are the only ones I managed to put here. Okay. Okay, so what complication? So this child has come with black water fever. The management, so we said this is a severe malaria, so we are going to give a test on IV, and we haven't been given the kg, so we're going to say 2.5 milligrams per kg if more than 20 kg body weight, or 3 milligrams per kg if less than 20 kg at 0, which is on admission, after 12 hours and after 24 hours. Then quartem after severe symptoms or signs regress. So that's the management for this patient. Then and two days later, the boy stopped passing urine. What complication has he developed? So the boy has developed acute renal failure, or you can even put an acute kidney injury, because in acute kidney injury on your rifle criteria, we find that they may have gone on F, which is failure, so still it will fall under acute renal failure, but just bear in mind that that's the way it is. Okay, so station 6, start the picture below. So there is this device. What is the name of the equipment? Name 2 other equipments used together with this equipment. In which childhood condition is the equipment used? What do the acronym GOBIF stand for with the prevention of the said condition? Okay, so if you've been on the wards, you've done some measurements, I'm sure you know this is called an infantometer. So don't confuse it with a stadiometer. So there's an infantometer, stadiometer. Okay, name 2 other equipment used together with this equipment. So we have the weight scale, the weight scale, then MUAC, mid upper arm circumference, or Shakir tape. So like I said, don't confuse this with the stadiometer, and these are some of the other equipment used together with this device or equipment. In which childhood condition is the equipment used? So severe acute malnutrition. Then what does the acronym GOBIF? So GOBIF, G is for growth monitoring, oral rehydration, breastfeeding. Then the I is for immunization. Then F is for food security or supplement. Then the other F is for family planning. Then the other F is for female empowerment. Then if you want, you can also put further involvement, because it's also necessary in the prevention of some. Then station 7, the picture below shows the neonate born at 28 weeks gestation. Describe what you see. What is the most likely diagnosis? What are the risk factors for this condition? What 4 investigations will you do? Give 2 complications of this condition. So as you can describe, describe what you see. Then the child is neonate. It was a prematurity. It was a premature child. So this is prematurity. So bear in mind the risk fact, the complications of prematurity and everything. So now on describe what you see, just describe what you are able to see here. So you can see some distended, there's a distended abdomen, there are visible veins on the abdomen, and also of course the abdomen is shiny, and with so to say the skin is shiny on the abdomen. Okay, then the most likely diagnosis, like I said, bear in mind that this is a premature child, and the most likely diagnosis here would be necrotizing enterocolitis, because that's one of the complications or the risk factors for developing necrotizing enterocolitis is being a premature baby. Okay, then these factors we have: small for gestation, prematurity, like I said earlier, polycythemia, aggressive enterofeeding, hypertonic milk. Then what 4 investigations will you do? So 4 investigations we can do: pre-abdominal X-ray, stool MCS, arterial blood gas, urea and electrolytes, abdominal ultrasound, and also remember your septic screen. You can just remember what's in the septic screen, and you put, so that at least you have a set of a set of investigations in your mind. Okay, so 2 complications of this condition: we have neonatal sepsis, intestinal perforation, peritonitis, electrolyte imbalance. Okay, so we are done with this question. So station 8: a 2-year-old boy presents to emergency room with history of fever and constipation for a week. Then the patient then developed diarrhea for 1 week before he started developing abdominal distension. So the temperature pattern of the boy is as shown. So as you can see, this is the 7, then it was going the 7 somewhere here, it was increasing like this. So the days of these are the days, this is the temperature. Okay, then question 1 is saying comment on the temperature chart. What investigations will you order? What is the most likely diagnosis? Then list 4 complications of this condition. So comment on the temperature chart. So there is a continuous spike in rise in temperature, or persistent step ladder fever, or stepwise increase. So you can see it's like more like a step ladder. So that's how the fever was increasing. Okay, then what investigations will you order? So this child presented to emergency room with no history of fever, constipation for a week. So it's within a week. So of course, if it's within that period, blood culture first thing first. Then of course, then these are last bone marrow culture, your full blood count, differential count, and of course, like I said, when you are writing in your exam, don't put initials. Then stool MCS, again, don't put initials when writing. Urine MCS, X-ray, abdomen, then abdominal ultrasound. So these are some of the investigations you can do. Then what is the most likely diagnosis? So this is most likely enteric fever. This is most likely enteric fever. Then complications of this condition, we have dehydration, hypovolemic shock, electrolyte imbalance, intestinal perforation, acute renal failure, intestinal bleeding, and of course there are others as well. Okay, so station 9, the picture below shows an under 5 card, so you can pause and check through what's on the under 5 card. So list 4 activities carried out at an under 5 clinic. List 3 inactivated vaccines given at the under 5 clinic. Which vaccines are given orally? Then give 2 COVID vaccines that you know. So I'm sure, but if you can pause again the video, you check everything that's on the under 5. So okay, the answers are, so there are a lot of activities, so just choose what you remember. So there's growth monitoring, immunization, deworming, prevention of mother-to-child transmission, your vitamin A supplementation, your nutritional status or advice, Then that's what I could manage to write. So make sure I write in your own order, because they were just wanted four. So just make sure you write in your own order. These three inactivated vaccines. So in the initials, make sure, like I said, you when writing in an exam, write in full. So for DPT, you know that this is diphtheria, pertussis, tetanus. Then HB, that's hepatitis B. Then HIB, that's Haemophilus influenza type B. Then the other inactivated vaccine is inactivated polio vaccine, which is called IPV. It's different from the OPV. This is IPV. Then you have pneumococcal and meningococcal vaccines. They are also inactivated. Then which vaccines are given orally? Then we have OPV. So this is oral polio vaccine. So like I said, when writing your exam, write in full. Investigations, what, write in full. And then of course, rota vaccine is also given orally. Then if this question was not maybe was not limited to answering on the under 5 card, there are also other vaccines that are given orally. Like for instance, though it's not given you on the under 5 card, but recently there were some last year they were giving Duke Oro, which is the vaccine for cholera. So this is also given orally, but that's not what they wanted here, if I'm not mistaken. Yeah. So just put OPV and Rota vaccine, but I just wanted to share with you that Duke Oro, which is the vaccine for cholera, is also given orally. Then give two vaccines, COVID vaccines that you know. So there's J&J, which is again, like I said, initials, Johnson and Johnson, AstraZeneca, and Pfizer, depending on the pronunciation. But these are some of the COVID vaccines. Then station 10, start the image shown. What is the name of the equipment? So the name of the equipment, okay, as you can see, this is the equipment. Give 4 indications for the use of the equipment. Give 2 contraindications for the use of the equipment. Describe how you insert this equipment. Okay, this is a nasogastric tube or a raised tube, but most likely a nasogastric tube, since they've stopped using people's names. Yeah. So give 4 indications. So we can use it for feeding purpose, your GIT decompression, gastric lavage, and also for medication or drug administration. Then contraindications, you can use you can't use it in esophageal obstruction or esophageal obstruction, when there is esophageal stricture, when there is esophageal perforation, when there is severe maxillofacial trauma, and also in choanal atresia. But the thing is, in choanal atresia is that they actually use it to make a let's say to help you make a diagnosis. When you try to pass the nasogastric tube in the nasal cavity and it fails to pass through, then you do other investigations as well. You can use it to help you make a diagnosis of choanal atresia. But after you've established that it's there, then of course it becomes contraindicated for you to actually use this equipment in this condition. So there's no need for you to actually use it because it don't go anywhere. Okay, so that's why it is here. Then describe how you insert. So don't master this because there are a lot, and this is an OSCE station, so you might not even finish everything. So the thing is, make sure on the words you actually try to do this a lot of times, so that even if, because maybe they won't ask you to describe, maybe they ask you to demonstrate if it's a practical or a manual exam. And even when you don't know what to write specifically, when you've done it a lot of times, you'll be able to remember just writing what you were doing. Okay, so let's start. So patient sits upright in the sniffing position with the neck slightly flexed. Then if unable to sit upright, the patient should lie in the left lateral or decubitus position. If needed, supine and bed elevated. Then of course you have to put on gown, gloves, and face shield, of course, bearing in mind that you have explained the procedure, you have gotten your consent. But yeah, then check for patency of each nostril by holding one closed and asking patient to breathe through the other nostril. So look inside the nostril for any obvious obstruction. Estimate the proper depth of insertion, about the distance to the earlobe or an angle of the mandible, and then to the xiphoid plus 6 inches. Note which of the black marks on the tube correspond to this distance. Or if maybe by chance there are no marks on the tube, you can even just put, or you just odd where the tube is reaching the 6 inches away from the xiphoid process. Then of course you have to use a lubricant to lubricate the end of the nasogastric tube. They gently insert the tip of the tube into the nose and slide along the floor of the nasal cavity. Then aim back, then down to stay below the nasal turbinate. And of course, ask the patient to swallow or take sips of water through a straw and advance the tube during the swallows. So I think even in the next exam, I think I was asked this question, say what I was supposed to, if it's in an adult, what are you supposed to tell the child, the adult, or if it's a child who can understand you properly, what are you supposed to tell them if you are inserting an NGT? And of course, the answer was just this: you ask them to swallow, as simple as that. And of course, others they even give water to take sips of water through the straw. Okay, then continue to advance the tube during swallows to the predetermined depth using the black marks on the tube as guidance. Then assess proper tube placement, and also this is also one of the next questions in the practical exam. So how do we assess proper tube placement? So just comment on the just comment on this video how you assess for proper tube placement, and I'll be glad to reply to you. Otherwise, this is the end of the video.